Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. Couple quick updates. Big investigative piece this morning on Oak Hill Nursing Home. Questions being raised on that facility, previous violations, as well as the track record of the corporate ownership that tracks all the way to Bronx, New York, and their facilities around the country. The state has decided that that's going to be sort of the depository to those nursing home patients who are coming out of hospitals and need to revert back to a nursing home environment. Secondly, I want to thank our dear friend Rebecca Cotto da Silva, who has joined us every week from Italy for 4 or 5 weeks to give us a perspective. Italy is about 3 to 4 weeks ahead of the United States and what life is like in Italy. And also on the scheduling front, Bob Whitcomb is going to join us at 12:30, and Governor Raimondo's presentation will be at 1 o'clock. Again, she is continuing to refuse to take questions live so that the public can hear it from reporters or their follow-up questions. One of the only governors in the country with that policy. Let's go to Dr. Michael Fine, former Director of Health. Dr. Fine, thanks so much on this Friday, beautiful Friday, for joining us today.
Good afternoon. Nice to see the sun again.
It is nice to see the sun, but I always worry when the sun comes out, maybe we get a little lax on our appropriate behavior during this period. Let's go to the numbers. Obviously, the most disturbing number was Thursday. More than 4,500 Americans passed away in a 24-hour period, a significant increase.
Yeah, and we're seeing sort of this fairly robust, lots of people sick story from around the world. So 2.2 million people around the world, 560,000 of whom have recovered. An increase of 100,000 new cases in 24 hours. Remember, that's a function of testing as well as disease. In the United States, 680,000 cases altogether, 30,000 new. That leveled off a little bit from the day before. Day-by-day changes probably don't mean much. It's the trend over time, and the U.S. trend isn't exploding, and that's good news. Deaths, we're getting close to 150,000 deaths around the world, 148,000, almost 149,000, an increase of 7,500, up to 34,000 deaths in the United States. 2,000, according to the sources that I use day over day, increased, but after a 6,000 increase before. So that's where I think your 4,500 deaths are in that time period. Anybody who doubts that this is a bigger deal than seasonal flu, you look at those death numbers, and those deaths are more than we see in a typical seasonal flu year, and we are just at the beginning of the peak. So I think as a nation, if we get anywhere under 100,000, we are really lucky, but I think it's going to get close to that. In Rhode Island, tough day, 18 deaths. We are at 3,800 cases. We'll pass 4,000 today. 309 new cases, 245 people in the hospital, 61 in the ICU, 43 on a ventilator. So it is, our numbers are going up, but in Rhode Island, we continue to do well in terms of the rate of increase. It doesn't mean that we're leveling off by any means, but the rate of increase suggests that our peak will be late and broad. So probably these numbers, or numbers like them or greater, for 3 to 4 weeks would be my guess.
You're seeing some worry numbers in Central Falls and Pawtucket. You're seeing significant growth in the number of cases. Talk a little bit about that.
Well, in Central Falls, we saw a tripling in 3 days, and a doubling in Pawtucket. A tripling is a huge increase in 3 days. Now, obviously, some of that is increased testing, but I have other sources of information that tell me that the testing positive ratio in both of those cities is about 24%, almost twice the test positive rate for the state as a whole. So clearly, those cities are emerging as areas of significant concern.
That amount of spread only multiplies, correct?
Well, we'll see over time. Again, we don't know whether it's testing or not, but 24% positive tells me that we have some risk of multiplication. You know, the tripling in 3 days suggests quick spread, and if all other things were equal, if the testing had been the same, then I'd be really worried about quick spread. But testing has increased a little bit in Central Falls, not phenomenally, but a little bit in the last 10 days. And that means that some of these changes may be just as a result of testing alone.
You've also flagged some concerns about the speed in which, from a positive test is identified to get out and do contact tracing, how long that time period is. Talk a little bit about what that time period is and why that's of worry to you.
Well, walk it with me. So I get a symptom today. I'm in a fair amount of denial, as most of us are. So, you know, tomorrow I'm beginning to think, yeah, maybe it really is a symptom. The next day I'm reading about all this stuff about COVID. So maybe the next day, 2 days later, I call a doctor. Now I can transmit disease probably from 2 or 3 days before I got the first symptom. So, you know, I've got a symptom. 2 days into that, I call a doctor. I get a doctor to call me back the following day. That's 3 days in, 5 days I've been transmitting. The doctor calls me back and says, you need a test, and works to schedule the test. The test happens 2 days later, which is 5 days from my first symptom. The result comes back between 3 and 7 days later. So that's 10 to 15 days later, the result comes back. And I don't have any good data about this, but I'm betting that I hear from somebody at the Department of Health 4 to 5 days after that, which means we've really spanned 15 to 20 days when I can be actively transmitting virus from the time I got a symptom to the time we really begin the process of contact tracing. That's 3 generations, as it were, of time period when you think about what the average incubation period is. So I could have spawned 3 generations of people with the disease who are out spreading the disease before contact tracing has begun, which puts contact tracing itself behind the 8 ball.
Listen, if you were staying home, that might be a limited implication, right? I might go to the grocery store once or twice. But if you're going to work, you're working in a factory, that has implications of hundreds, if not thousands, over that 2 to 3 week period.
That's exactly right. And, you know, I think part of our problem may in fact be, at least our problem in Pawtucket and Central Falls, where I kind of know things best, is that people are going out to work, getting sick at work, coming home, and then spreading the disease at home. And that's where we're seeing, and I think gonna see, more and more cases because so many people are working. Turns out that, I think I have this number right, only 20% of low-income people and people of color can work from home, which means 80% if they're going to survive are going out to work one way or the other, if they can.
Right, and as we all know, the economic number going into this economic crisis, 40% of Americans had less than $400 in savings to deal with any kind of emergency. Those dollars are long gone.
For sure. And, you know, if you have access to unemployment, that's great. But certainly if you're undocumented, you don't. And unemployment doesn't usually pay people their full check. So if you're living right on the margin and you have to choose between unemployment and working, I think you're going to choose to work. And it's exactly that person who's going to work every day, who's going to be at risk for disease transmission, particularly if it takes us such a long time to tell people they're positive. I mean, yes, I think we tell people if you're sick, stay home, and that's a good thing. But we have no enforcement mechanism, no oversight mechanism for 2 to 3 weeks, and that just seems to me risky.
In a place like Central Falls, highly densely populated, 19,000 is it? That's
Right.
in 1 square mile. Can we almost assume that within a week or two, everyone will be exposed to this?
Well, I'm always careful about assumptions, but I think we are at great risk of spread. And it's 19,000, not including the undocumented population, because we don't count that population. We don't know what that is. I think the seat of the pants is it's 3,000 to 5,000 undocumented people in Central Falls alone, 50,000 across the state. And what I worry about is all the good work people have done at working with social distancing and at slowing the pace of progress. Into all that good work and its impact on our hospitalization rate and our ICU rate will be undone if we get 10% of the 50,000 undocumented needing the hospital.
Right.
I mean, that's 5,000 people in the hospital all at once, and that's a big number. And there's some national data that suggests 10% of the undocumented are over 60. And so that's a huge risk pool right there.
And that'll be balanced off, sadly, with those who don't seek medical care and will, in fact, in some cases, pass away at their own homes.
That's exactly right. And that's what we've got our eye on in Central Falls and Pawtucket. That is what we worry about. And that's why we're thinking so much about how we reach out to every single person and how we make sure everyone knows what to do and how to do it and make sure everybody has support.
Listen, in today's update on 7 major coronavirus issues on GoLocal, there's a lot about the data, frustrated healthcare experts on not being able to get their hands around the data. We learned today that China had wildly undercounted the number of deaths in Wuhan. Not a surprise to anyone. And even with the revised numbers, I'm not sure anybody believes that number as well. Why in a big data 21st century world where we have electronic healthcare records and lots of capture of data, are we so struggling to build the information system and control the amount of information to be able to make smart decisions?
Josh, we don't have a healthcare system. Every mom and pop healthcare practitioner, every hospital has its own healthcare system, and they don't talk to each other. So I can't flip a switch and tell you, who's got what in terms of diseases. As I've said before, there are only 2 sources of population-based data: birth certificates and death certificates. Death certificates, I think, in the last week have come online for the first time. I heard on a conference call earlier in the week that doctors can now fill out death certificates electronically. Before that, they had to get out of their houses and go and find a piece of paper and fill it out. And even then, they're probably the least accurate sources of information you can imagine. We have not thought about what it's like to build a healthcare system that provides the same set of services to all Americans. We have not scratched the surface of what we can do with electronic data systems in healthcare. Shame on us, and this is a kick in the pants. If this kick in the pants isn't good enough, I don't know what is.
And yesterday or the day before, the rating agencies downgraded both Lifespan and Care New England, the two largest healthcare systems in the state of Rhode Island, and both financially struggling. Lifespan last year lost $55 million, made up a little bit on their investments, and Lifespan over the past 3 years has lost $130 million. These are non-sustainable financial models and put a lot more pressure on them as a result of this healthcare crisis.
I'll say it and I'll say it again. doing it the way we do it, using the market and begging the market to come forth and provide the services that we need, is a backwards way to approach this. We need to think out what services we need to provide to everyone. We need to build those services, and then we need to pay for them. Instead, we've had 40 years of a backwards political discussion that goes, let's figure out how to pay for it, and then maybe we can figure out what it is. That's backward.
Right.
So it takes away our opportunity to conceptualize, to operationalize, and to use our healthcare spending to actually improve the public's health. Instead, it comes out as profit for some and chaos for the rest.
All right, Dr. Michael Fine, anything else people should know, should keep an eye on as the numbers roll out over the weekend?
Just keep doing what you're doing. Stay safe, stay home, wash your hands a lot. All the things we've been saying all along continue to be true, but the most important thing today, as I see the world, is the moment that you are sick, take yourself into a room, lock yourself there for 7 days, and call us if you get short of breath, but make sure that you stay isolated so you don't spread the disease to others, please.
Thank you, Dr. Michael Fine. For everybody else, we'll be back at 12:30 with Bob Whitcomb, columnist to GoLocal, longtime editor of the editorial page at the Providence Journal, former Wall Street Journal reporter. And then at 1 o'clock, the governor will be giving her remarks. Thanks, everybody, for tuning in. We'll see you back in a few minutes.
Thanks, Josh.